Thank you for letting me present today. So this is Baby Teeth 101. So we're going to start with the basics with what we need to know about teeth. So first, I just want to introduce myself. So how I got involved with parents as teachers is as a mom, actually, not as a dentist. My parent educator, we were speaking and we found that we started talking about teeth more than anything else. And so she just invited me to speak. And then since then, I've just, as I say, have spread the good word of dental health for kids. And I'm just excited to try to just inform parents and empower parents to make the best decisions for their kids. And that's my husband. He's a chiropractor. So we have, fake doctors. That's what I say. We're a family of fake doctors. And so a little bit about me. I'm a pediatric dentist, and I work at both St. Louis Children's Hospital, and I have a private practice called Skyview Pediatric Dentistry in Town and Country. So you basically can find me along the 64 corridor in St. Louis County. So first, I want to differentiate what a pediatric dentist is. And the best way to describe it is a pediatrician of dentistry. There's absolutely nothing wrong with going to a general dentist, so the family dentist. The difference is that a pediatric dentist actually went to 2 additional years of schooling, and we only see kids. So we learned more about medical conditions, following up on the development of the jaw and the teeth and what is, quote, typical. But most importantly, it's the behavioral aspect of it. All of us like kids, but it's not only liking kids, it's a matter of informing parents, working with the parents to make sure that they're educated to make the best decisions for their family. And we just have the smaller stuff for kids' mouths. And so by having all of those materials, it makes us unique. And this is the question that I know that was asked, and that is, when should I bring my child to the dentist? And the answer is at 1 or the first tooth. And this is definitely not something that I found that is enforced a lot in St. Louis and brought up at the 1-year visit by many pediatricians. So no parent should beat themselves up if they've not brought their child to the dentist yet. But my recommendation is to make that phone call and make that first appointment. And I can give you some expectations of what that's going to look like. It's not going to be the same as when you go to the dentist. So why 1? First, I always tell families it's important to develop your healthcare team. You have a pediatrician, you live in a certain school district, you want to have, if there's an emergency, you want to have your backup, you want your babysitter, you want those things. And by developing your team and your people that you're going to go to if there's an emergency, a dentist is one of those people. Kids tend to fall on their face, so you want to have that resource. The other thing is get your questions answered. As a mom, I realized that the pediatrician has to talk about a lot of stuff. And because they have to talk about so many things, it is important for you to be able to go to a dentist so that you can get your questions answered when you don't have time at your pediatrician visit. The other thing is we want to change habits early. It's an important time for us to figure out, okay, when are we brushing teeth? Making sure that's part of the daily routine. And if we can change habits early, we want to do it. And the other thing is finding those problems early. As parents, we have to look at a lot of things. And by going to the dentist, we may be able to see something and address the problem before it actually is a big problem. So I know as a mom, I was like, if I was a mom and I wasn't a pediatric dentist, I'd be like, there's no way you're going to be able to do an exam on my kid. This is actually one of my co-residents. So someone who trained with me, he's in Texas. And this is the typical positioning of a first 1-year visit. Notice that it may not even be on a dental chair, and that is okay. What you do is you just lean the kiddo back, and that gives an opportunity for when the kid's screaming, they open their mouth. And when they're done, they can pop back up and be hugged by mom or dad. So it's a great way for us to get a good look, have comfort of a parent. And actually, this is a great way to brush teeth at home as well. So I like to talk about importance of baby teeth. And it's funny. So as I present, I hear the word so. That's a Midwest thing. My husband's from the Northeast. I didn't know that until he's like, you all instead of saying therefore, you guys say so. So anyway, importance of baby teeth. First, it's important to help to chew and speak. Pretty obvious, right? The other thing is those baby teeth hold space for the adult teeth to come in. So when you have a cavity on that tooth, there's so again, when you have a cavity in those baby teeth, if you lose it early, those teeth can close together and block out one of those permanent teeth that don't come in until about 11 or 12. Teeth also aid in the jaw and face formation. So it's not just teeth, it's to make sure that the jaw and the actual face forms correctly. When we lose teeth, or if there is no tooth there, you may remember someone who doesn't have any teeth, and if they haven't had teeth for a long time, their face collapses. Therefore, we want to make sure that we have those teeth there to support the bone that those teeth are held with. What makes up a tooth? This is the sciencey section of it. The most outer layer is enamel. That's the stuff they talk about in toothpaste commercials. The layer next to that is dentin. And dentin is actually a lot of little tubules. So if you have sensitivity with your teeth, those tubules are being affected. There's the layer of cementum, which goes around on the bone. And then your teeth are actually held in to the bone by a ligament. And if there's trauma, that's the part that actually is damaged. So those ligaments is why whenever you bite into something, those teeth flex a little bit. Gingiva is gums. Pulp is the dental term for the nerve. And then the bone, like I mentioned earlier, is what holds those teeth in. Next, we'll talk about baby teeth. The first thing I want to point out on this picture is there's a lot of spacing in between the baby teeth. Dentists like seeing spacing on baby teeth. There are 20 baby teeth, and those are the names that we used. Notice that it goes canine, and then, so I'll use my pointer. It goes canine, which is right here, first molar, second molar. Molars don't come right there. They're actually premolars and permanent teeth when they get their next teeth. The teeth in the eruption, so as I said, there's 20 teeth. There's 8 incisors, 4 canines, as I call the vampire teeth, which is in line with Halloween. And then there are 8 molars, 10 on top, 10 on bottom. When you go to the dentist or your child's dental visit, you may hear the terms us singing the ABCs. Baby teeth are identified by letters, whereas permanent teeth are identified by numbers. Like I said, primary teeth spacing is a good thing. We like seeing space. That allows for room for those permanent teeth to come in. Permanent teeth. When we look at permanent teeth, you'll notice there is not spacing here, and this is the perfectly aligned jaw. You have those 4 incisors on top and bottom. You have canines on both top and bottom. Then premolars, which actually take the place of those baby teeth. And that doesn't happen until kids are about 11 or 12. Behind those teeth are the 6-year molars. Behind those teeth are the 12-year molars. And then behind those teeth are the wisdom teeth. And we'll talk about the timing of those in the next slides. If you have all of your permanent teeth, including your wisdom teeth, there are 32 of them. And that lists the names of what there is in existence, 16 on top, 16 on bottom. So most of us actually only have 28 teeth because many people have gotten their wisdom teeth taken out. As I mentioned before, permanent teeth are actually numbered, and we number each tooth. There's permanent teeth again, nice, beautifully, probably orthodontically corrected smile. Teething. So this is my kiddo when I think this was his 6-month appointment, and he was getting his first tooth. Pretty commonly you get that lower teeth. And I tell people that I was blessed with a terrible teether to make me a better doctor because I tried all the things and none of it worked. So I can empathize with families because yeah, sleeping was terrible. Still is not great. When teething starts, they usually come in around 6 months. Something to keep in mind, some kids are born with teeth and some kids don't get their first tooth until they are 18 months old. That range is okay. There's no, the range that they gave us is actually based off of farm kids in Iowa. I'm not kidding. So we are not all farm kids in Iowa. And that is what we all need to recognize, that a variety is okay. The second molars are the last to erupt, and that usually occurs around 2.5 to 3 years old. So although they're called 2-year molars, they may not be in by 2. This slide I really like because it does give you that identification of what teeth come in when. Usually the first teeth that come in are those lower primary molars, and then, primary front teeth on the bottom. And then kids get teeth on the top, and it goes in succession from here. Some things that I think parents need to keep in mind: those first molars, those 1-year molars, usually come in before the canines, and there's supposed to be space there. The other thing is when those top teeth come in, they may not come in the 2 central ones. They may come in with those side teeth first. And again, variety is okay. We do get a little concerned if you get a molar before any front teeth, and that's when we would want you guys to go see a dentist so that we can take the x-rays that are necessary. Teething, and this is one of the problems that can occur. Whenever a tooth comes in, sometimes there's a little bit of blood, a blood vessel burst. Basically, it's a bruise, and it's called an eruption hematoma. It's a bluish swelling. It's usually doesn't cause a lot of issues. It just looks painful. There's no treatment required, and the tooth usually breaks through that busted blood vessel on its own. Sometimes it's a little bloody whenever that happens. Teething, we all know these symptoms if we're parents. So fussy, irritable, and sleepless. Another thing is everything literally goes into the mouth. And drooling, lots and lots and lots of drooling. Here's the thing that I think is an interesting conversation. It's not a true fever, but like I said, everything goes in the mouth. So the pre-COVID days when our kids were in public, their hands were going in their mouths, and they were likely getting a virus of some sort. And it's usually a comorbidity. So they're teething, they're cranky, they're putting their hands in their mouth, they're giving themselves another virus. They usually get an ear infection, and it's just a terrible tornado of events. So I do think the temperature is elevated a little bit whenever they're teething. Everyone agrees with me in that, but no parent's going to volunteer their kid while they're teething to get blood work done to see what actual hormone levels are going on. So the research really isn't out there. However, if your child has a fever over 100.3 or temperature over 100.3, it likely is not teething. 99, sure. I think that could just be teething. Over 100.3, there's likely something else viral going on. Things to avoid. So this is actually as of December 20th, 2018. The FDA warns against amber teething jewelry. My husband's a chiropractor. There's some people who believe in the powers of amber. I did a little research on it on my own to see what it was. Amber, the healing qualities of amber it's exuded with heat. And the body temperature is not the ideal temperature for those healing effects to occur, from what I read. The main reason why the FDA doesn't recommend it is the choking hazard. Another thing to avoid is benzocaine. Benzocaine has something that can cause a bleeding it's a blood disorder that you may not know, and you would find out by having too much of the benzocaine. And it's super easy to overdose on. The recommendation is just to avoid it until your child's a little bit older, so that you don't find out the hard way if your child does have any anemias that would be affiliated with benzocaine. The other thing is it numbs up the whole mouth, and with them having that extra drool, it's not going to stay very long. Solutions. That's what I was looking for as a mom. Increase fluids, okay, whatever. Ibuprofen or acetaminophen, I think that's the best thing that you can do, only when your kid's really cranky. Personally, I found ibuprofen works better. It's an anti-inflammatory, seems to work better. Cold washcloths. This is something that I think was helpful because it lets the teeth get in faster. If you put a wet washcloth in a freezer and then thaw it out a little bit and then have the kid chew on it, those fibers tend to help get those teeth to erupt a little bit faster as well, and it's a soothing thing. Teethers, my kid had no interest in them. Fruit feeders. I thought this was a really cool thing. So there's on here, I like the silicone kind because then ones with nets I thought were disgusting to clean. So what you can do is put some baby food in there and then some fruit and then put it in the freezer, and then they can gnaw on that. And it tastes good, and it's not using that cold washcloth. You just have to be careful with temperatures. You don't want it to be super, super, super cold. Habits, a very common question and something we address. First, we'll talk about the pacifier. So the pacifier is something that it's tricky because if you're breastfeeding, they tell you don't use a pacifier, but then the Mayo Clinic says do use a pacifier, does not use SIDS. or not have SIDS, and then by 1, they don't need it. It's just tricky. And it's hard because you just want your kid to be soothed. And with pacifiers, there is a variety. And I have my next slide talks about the best things to do. Bottom line, if you quit the pacifier by 3, typically this open bite presentation here closes down. Quit by 3, you should be okay. Thumbs. Unfortunately, you can't cut your child's thumb off. And so because you can't cut your child's thumb off, it's not worth you stressing about the thumb habit. Most kids are not even cognizant and willing to quit until about kindergarten. That's where you can have the conversation, but shaming your kid is quite frankly not recommended. There are tips and tricks that we can work to try to do. Charts are always welcome. And when the child just needs a reminder to not do it, that's when we recommend quitting. When it's something they don't realize they're doing, there's different fingernail polishes and things to do like that. But if the kid doesn't want to quit, they're going to keep on doing it. They're going to break the appliance you buy, the arm thing, suck through any fingernail polish. So it's not worth the headache. There's not much that braces can't fix. As long as you see an orthodontist, it's something that can be fixed. Just everybody needs to take a deep breath and go from there. But with pacifiers, if you have a pacifier, I'm going to give you some advice. In the hospital, they tend to give the one that looks like the Nook pacifier that's right over here. And if you notice, it looks like a finger because you can stick the finger in there. When I see a 2-year-old with that pacifier in comparison to the pacifier that has that flatter profile over here, this mouth is likely going to have an open bite in comparison to this one over here. This brand is MAM, M-A-M, or Smilo, S-M-I-L-O. They are both have this flatter profile right here. Transitioning sooner than later is beneficial for babies. This right here is literally sticking a tube in the mouth, and the palate, which is the upper part of the mouth, will form around it. Just a piece of advice for choosing what pacifier brand. I do notice there is a difference. Let me see here. I moved you guys so I could see my own picture.
Sorry. Now my dogs are going to bark. That's really interesting. I never thought about the different, because I see that Nook brand all the time. That's what we used for sure, because that's what they came home from the hospital with. And then, for heaven's sakes, and then we never swapped anything ever again. And I mean, they were done by 6 months. Nobody wanted a pacifier. But so if they're going to use a pacifier, we should encourage them to use the MAM, that kind. Now I'm going to mute my.
Right. And I'm not endorsing a certain company. It's just that by doing that, it helps. It helps a lot. So that's just and a lot of this is just me being in practice and seeing what works for families, and also seeing the effects of kids who are aggressive pacifier suckers and not. Because there's some kids who use that Nook and I don't have issues, but they just let it sit there, or they have it sitting on the side, or it falls out of their mouth. There are some kids who are aggressive with that pacifier, and that's where we do definitely see those variations. Okay, so I think this is important to know for families in case there is trauma ever. How can I tell the difference between baby teeth and permanent teeth? First, baby teeth are smaller. And that's, the obvious thing. The other thing is baby teeth are more white. Parents often ask, especially in this phase of their life, can I whiten my kid's teeth? And that's when I tell them, actually, it's an optical illusion that you're looking at. When those other permanent teeth come in, they're going to be the same color as this one here, and it's going to look white. But since baby teeth are so white, it makes the permanent teeth look yellow. So give it time. They call it the ugly duckling phase for a reason. So just give it time. The permanent teeth, the other thing to keep in mind is permanent teeth have something called mamelons. So if you look right here on the edges of these permanent teeth, they have these these ledges. Those are typical. Those are normal. It's not shark teeth. Baby teeth wear down pretty easily. So because the enamel's thinner, and that's why they get cavities faster as well. So also keep in mind what else is in their mouth. And if you can remember the eruption times. So we lose those front teeth between ages 6 and 8. You also get those 6-year molars. Then 2 years later, around 10 to 12, you lose 12 more baby teeth. And that's the phase where parents are not really aware that their kids are losing teeth. And they sometimes come into the emergency room being like, they have lost all their baby teeth. Why are their teeth loose? There's 12 more back there that no one really talks about. So just keep that in mind. Toothache problems. Most common emergency is we have a loose baby tooth. There's two types of kids out there. There's the kid who rips out the tooth when there's half a root still in there. And then there's some kids who literally let the thing hang until there's a blister around the tooth. If you have a 6-year-old who's not willing to pull out a tooth, that's the time to use that Oragel. Wipe the tooth or wipe the area that's super red because they're not wiggling their tooth. Dry it off. Get a Q-tip, put some benzocaine on there, which is Oragel. Put it on there. That's basically the same topical anesthetic that we have at the dental office, and then have dad rip that thing out. Because you can do it at home. You can bring them to the dentist. That's fine, but your dentist may charge you for something that's very simple. So just giving you fair warning. Emergency. So this is something that we see a lot. Saw it today. Ectopic eruption of shark teeth. This is where teeth are. These teeth get extracted. It's important if all of their teeth are coming in like this to come into the dentist. This top tooth here this is a kid.
You're frozen, Emily.
The root is still completely there and the permanent tooth developed behind it. That's where the dentist does need to come in. Don't put that gel on there and have dad rip that out. I will say that.
Emily, can you say that one more time? You were frozen at the very beginning of that. So those front teeth are what?
These front teeth here are like the ones that I had talked about earlier. Those can probably be taken out with that Oragel. The ones on the bottom, though, where they probably have full roots. So when a tooth looks like this one right here, that one I would have an x-ray taken and then the dentist can take care of it. You don't want dad to take care of that one because that could hurt. So if there's a question, honestly, go to your dentist. But if that tooth is wiggly, generally parents can get those teeth out. So let's get ready to rumble. This is the stuff that's really important because it's dental cavities. Dental caries is the term that we use. And I do see mouths like this at least once a week. So cavities. Tooth decay is the single most chronic childhood disease. It's more common than asthma, early childhood obesity, and diabetes. This is something that we need to address, and that's why I like having these conversations so that we can get the word out, because for the most part, it's preventable. Over 40% of children have cavities before they enter kindergarten, and the prevalence is actually increasing, and they use the term poor instead of impoverished in the report, which was shocking to me, but especially in children who are in more impoverished communities. Children with immigrant backgrounds have the highest cavity rate, and then children in a higher income generally don't have as many issues. And I think that's probably because of the access to care. So what and how do cavities start? First, you need a substance for things to latch onto. That's a tooth. That's the surface that it latches onto. The next thing is bacteria. The bacteria, as I'll talk to in a minute, is generally passed on from mom to kids. So that bacteria sits there. That's the plaque, the fuzzy stuff that sits on 8-year-olds' kids' teeth. And then you just need food for that bacteria. That bacteria eats sugar, primarily carbohydrates. And then if we don't brush that off and that plaque sits there, you have the time component. And that's how you get cavities. Like I said, the most usual method of transmission is from mom to kid. The first 2 years of life are what is most important. They find that the earlier that bacteria transmits to the kiddo, the more likely that child is to have cavities. So my recommendation, if you have cavities yourself or have a history of it, try not to share spoons, try not to share straws, try not to do things that you could literally pass on that bacteria. Cavities are contagious because it's a bacterial infection. If there's anything that people remember from things I say, it's please remember cavities are contagious. Parents should the best thing you can do for your kid's mouth is to have a healthy mouth yourself. going to the dentist is important to make sure that your kids don't have that fear of the dentist, probably because you had a poor experience as a kid, unfortunately. And I'm sorry for my profession because I get told daily that people hate me. I am sorry. I'll apologize for the dental community, but our goal is for your kid not to have that experience. So what's the most common cause for cavities in kids under the age of 3? This is a super old picture, but it's that bottle in the bed. We want to make sure that we try to avoid that. As a mom in the middle of the night, it is so tempting. But the best thing you can do is take your kid out, give them whatever they need, and know their little brain is picking up on cues. Do not put that bottle in the bed. So how does a baby get cavities? Because, how does that even happen? Well, first they got the bacteria from somewhere. If they go to bed with a bottle, the mouth never gets a break. At nighttime, we actually create less spit. So our mouths aren't rinsing everything out. When that milk sits, it actually feeds the bacteria because milk has sugar in it. And as I say here, it's a beautiful disaster. So dental cavities, the best way to prevent it. First, a proper diet. So we all know what is healthy and what's not healthy. That's very important. It's also the frequency. Kids who tend to graze or snack, if it's like they take a grape, go play, get another grape 5 minutes later, those are the kids that get cavities, the grazers. Good oral hygiene, making sure that the parents brush until you would trust your own kid to brush your teeth. If you would not trust if you would let your kid brush your teeth, perfect. Let them go on their merry way. I used to say when the kid could write their name in cursive, but I still think that's a little young. So get in there. I would say 7 or 8 is a good age to transition. Other things that we can do are fluoride. So that's coming to the dentist, making sure we use fluoride toothpaste right away. That's to come as well. Sealants on those back permanent teeth that we talked about earlier. We want to cover those grooves. The anatomy, the shape of those teeth have natural grooves in them and stuff gets caught easily. And then xylitol and chlorhexidine. Those are other things that we can use. Xylitol is in a lot of gums. I like a lot of gums, especially if they have that xylitol in it.
Emily, I'm always asked from families, at what age should they start to use fluoride toothpaste?
The answer is when the first tooth comes in. What matters is the amount you use. Okay. And if you don't want to brush the most important time of day, so the answer to the question is first tooth. However, you only want to use a smear of toothpaste, so very little, nothing like what the toothpaste commercials come out with.
Okay.
And then the other thing is when you place that fluoride on the teeth, the most important time to place that is nighttime. If you're going to brush at night. The last thing that should touch the mouth at nighttime is a toothbrush with that smear of toothpaste. Morning, if you want to have that as a habit, that's great. You can use whatever toothpaste you want. Personally, I think the non-fluoride toothpaste, it just gets kids wanting to eat it, and it doesn't create the best habits because you put more on there because you don't want them to swallow it, but they get in the habit of swallowing toothpaste that way, and then you run into the issue of the kid grabbing the fluoride toothpaste and squeezing it in their mouth because kids at that age can't read. So that's why I would start that habit younger.
Mm-hmm. Okay.
You're welcome. So parents need to be aware it's not the bottle, it's the beverage. This is me speaking. I'm sure speech therapists are going to have very different perspective on what kind of bottle. I rarely give advice on the type of cup that they have. It's the issue with if they keep a cup in their mouth where it's acting like a pacifier. It's especially an issue if that cup has juice in it or milk in it where they're sipping on it throughout the day. Again, it's all about frequency of diet. If the kid chugs and throws it away, it's generally not a problem. The best way of explaining it is I would much rather someone chug a 2 liter of soda in one sitting. This, again, I'm not a dietitian, I'm a dentist, than sip on a cup of anything throughout the day. And I'm guilty of that with coffee. So do as I say, not as I do. Seeing decay on teeth. This is why it's really important to make sure that you go to the dentist because it's hard to see some of these spots. The most common place that baby teeth, especially with severe early childhood caries, is the back of the teeth. And we can see that when we do that first exam. Another question that I get asked pretty frequently is, does breastfeeding cause cavities? This question usually is asked with a co-sleeping family as well. And the answer is ad lib breastfeeding should be avoided after the first baby tooth. What that means is the breast should not be used, especially throughout the night, as a pacifier. It should be kind of like scheduled meals. And this is something that most people are scared to encroach this topic because we're a society that really encourages breastfeeding, which I am. I breastfed myself for 13 months. Well, I breastfed my son for 13 months. But in that time period, it was important to differentiate the times when we eat, especially when that tooth came in. It's the constant sipping and grazing when your child is 18 months old that we do get the risk of cavities, because those kids are eating refined sugars and that's mixed in with the breast milk. That's where we run into issues. Bottom line, the last thing to touch teeth at night should be a toothbrush. I don't recommend breastfeeding throughout the night, especially if it's ad lib and every hour. One thing that if you do feed in the middle of the night, which many parents have to do, if it's a bottle, whatever it is, I recommend something called Xylitol Wipes. This is the brand I use for my own kid to wipe them. They taste really good. It's similar to like what that Trident, mango, whatever tastes like. And it's in a wipe form. So instead of bringing your kid and the other thing, you don't have to go to the bathroom to brush your kid's teeth. If they're not spitting, it doesn't have to be in the bathroom. So if it's most convenient for your family for it to be before bed, to be in their bedroom, that's okay if they're not spitting yet. Xylitol Wipes is an even better solution in my mind because it's less aggressive than a toothbrush. You can just take this wipe their mouth out before bed and put them back after you feed them, do a night feeding if they have teeth early.
Emily, at what age do you recommend families to start having their child spit then once they have that fluoride toothpaste in their mouth?
So I think what I do is whenever you're in the bathroom and they can stand at a sink, you practice. It's just the practicing. So that could be as young as, 12 months. If your kids can stand at a sink and practice spitting, that's good. The likelihood of the 18-month-old, even 3-year-old getting it out well is not high. Aiden is a child of a pediatric dentist who's been practicing spitting since he was young, and he's just now getting the concept, and he turns 3 in a week. So I think that kids, they understand the concept, but just practicing. Everything is all about practice. And until he's not probably going to get a larger than a smear for a while until I'm confident that he's spitting it out well.
Okay, thanks.
No, you're welcome. So plaque is an invisible film that is noticeable when scraped off the teeth. So this is the, one of the scary dental tools. And I can see a tooth and notice that it's plaquey, but generally to the public, you may not notice that. And that's why it's another reason it's important to go to the dentist starting at 1. When plaque rests on the teeth, I'm going to make sure, okay. When plaque rests on the teeth a long time, white or chalky areas can develop. Remember that schematic that I had. This is after that plaque, that bacteria sits there for a while, and this is after it gets scraped off. The white spots break down into cavities if the teeth are not brushed appropriately. And this is right here. When brushing your teeth, and this is us included, everyone has the habit of brushing their whole tooth. The area that really matters is right where your gum and tooth meet. Getting the toothbrush in that area is the most important area. And even when most adults get cavities in between their teeth, brushing along the gum line is super helpful. I like electric toothbrushes, but not everyone has to use them. It's how you brush, not the kind of toothbrush you have. Same with toothpaste. It's as long as it has fluoride in it, it doesn't matter. As long as your kid doesn't think it's gross. If the cavities get bigger, they do need to be fixed so that it doesn't progress to an infection. Large cavities can damage the nerves of the teeth, which leads to an abscess. And these are old abscesses, actually. This is the area where if the family does have a concern, that's where they need to look. Cavities. This is why we take x-rays in an dental office. We can look, if I looked at this kid's mouth, I would not see any cavities, but these dark areas here, and sorry, this image is kind of blurry, but this right here is a cavity, and this part of the tooth is completely healthy. Again, we cannot do a good dental exam unless we take x-rays. A common question I get is, when do I need to get my child x-rays? And that is totally, it depends on the child's mouth. The best answer is it's balancing behavior and cavity risk. But if your child's teeth are touching in the back where when we floss things happen or they touch and then you get a snap, we would likely like to get x-rays on those back teeth. This is a tooth where that cavity started in between and then literally broke the top part off. And that's why we like getting x-rays, because we don't ever want to see a tooth progress to this area. Flossing. Floss is needed if the teeth are touching, like I said. Practice is good. Right now, Aiden only has one tooth that's touching in the back. And yes, we floss it, not every single night, but he knows exactly. He opens. He's pretty cooperative because I've desensitized him, not because I'm a pediatric dentist. And a parent will need to help with brushing and flossing until the child can tie their own shoes. Or I said, you would trust your kid to brush your teeth. So I have 6 to 7 here, but I think I would change that in my mind to 7 or 8. The new culprit, and this is something that I get, Aiden, the vitamins he takes are gummy vitamins. However, anything gummy is sticky and it sticks to the grooves of the teeth. If you're going to do a gummy vitamin, my recommendation is doing it in the morning so that throughout the day when we create more spit and we eat, those grooves of the teeth can be washed off. I'm not anti-vitamins, I'm just anti-sticky. Also, fruit snacks. Fruits, although it has the word fruit, it's a candy. If you can avoid fruit snacks, avoid them. I like this slide, so it's in tune with right now. So how to properly eat candy corn, throw it in the garbage. So this is a meme just for people who don't like candy corn, but this is perfect for dentists because it's sticky. During Halloween, I'm giving out candy, but do you know the candies I'm giving out? Chocolate. Chocolate melts. So that's a perfect thing for you guys or for kids to eat. So Kisses, M&Ms, that's how I'm potty training, M&Ms. We're using M&Ms for potty training. I don't use Skittles. Another good one, Smarties are good, Sweet Tarts, as long as they're not the chewy kind. The things that I disdain and I'm sick of picking out of teeth are the following: Starburst, Skittles, Taffy. And then what are those? I can't think of the other, but those are the types of things that you want to try to avoid. That's the stuff that you can steal. Like, there's the one guy who says, I ate all your candy. That's the candy you should eat for your kid because your kid's enamel's smaller. So that's your reasoning there. But I recommend as a dentist, chocolate, Reese's, Kit Kats, things like that. They're just healthier in general for those teeth. Here's this slide that I think is helpful to see. When to start using fluoride toothpaste, it's at 1. And you can see on this slide right here, this is the amount that I recommend until they can spit. Quite frankly, none of us really need to use much more than that because it's really to help the toothpaste companies make more toothpaste, so we have to buy more. This is going on YouTube. I'm going to be like blackmailed. So fluoride. Low levels in plaque and saliva stop the breakdown of the tooth. And that's why we want to start doing that right away. It enhances remineralization. Those white spots that we saw on those teeth in previous slides, we can remineralize teeth with fluoride. It actually affects the metabolism of the really bad bacteria. And then high levels from varnish produce a temporary layer. So fluoride releases when the mouth is acidic. That's another reason why we want kids to go to the dentist, is to make sure that we get that fluoride put on. All right, what is my husband saying? All right. Halo effect. Another thing that people ask is if they live in an unfluoridated community, what they should do. And I always say, I don't think you should take a vitamin with fluoride. And this is my own personal perspective. There's other professionals that may have a different recommendation. The reason why I don't recommend fluoride supplementation in a vitamin is that it's most places where foods are produced are in communities that are fluoridated water. A good example is there's actually fluoride in Coca-Cola soda. There's fluoride in formula. There's fluoride in all of these places. And how do you supplement someone when you don't know how much they're getting outside of that? The best thing you can do is get water that is fluoridated. So there are some bottled waters that do have fluoride in them, but brush your teeth. Brush those kids' teeth with fluoride toothpaste every single night. And by doing that, that's going to be super helpful. Another thing that is pretty common in the pediatric dental world right now is a lingual phenectomy. It's the snipping of the tongue. That is, at least in this area, I always recommend an evaluation by a lactation consultant to see if that's an issue with latching. I personally don't do lingual phenectomies just because I have providers around me that do them really frequently because I work with ENTs really closely. And there's also a pediatrician across the hall from my office who does them. Work with a lactation consultant or a speech pathologist. I don't think it's something that we should just be snipping away just whoever comes in the door. However, it has been proven to be very beneficial, especially for airways. And I think we're going to continue getting more information on that in the future.
So Emily, do you feel like there's an increase in this? Because when I had my older two kids, like it was never even spoken of or talked about. And my youngest, he had a tongue tie. And so he was like failing to thrive. And we took him to the pediatrician. And that was the first thing she mentioned was we needed to go have that corrected. And we did with an ENT and it was fine. But I have so many families right now that are dealing with this. And then they're asking about like, well, should we just have it clipped or should we do the laser? And so is it just something that's newer or, I mean, did we have tongue ties as kids and we just
Probably.
didn't know? Okay.
I mean, I would say probably it's kind of like tonsils and adenoids. There is a time where every single kid got their tonsils and adenoids removed. And then we swung back to the trend of no one gets their tonsils and adenoids removed. And now it's somewhere in the middle. Tongue tie, I don't foresee this one swinging back to not ever happening.
Mm-hmm.
My field is looking more and more at airways for kids and how kids sleep and how that affects their behavior. And with that being said, the movement of the tongue is super impactful in the development of your airway.
Mm-hmm.
And I foresee this continuing. I think we probably all had issues. Some of us thrive, probably some of us still have tongue ties and just have learned to cope with them with our speech and we have compensated for it. And I mean, it's also like breastfeeding. My mom didn't breastfeed. And if she would have had that information, she would have totally breastfed. But it wasn't something in the 80s that was really pushed or discussed. And so I foresee this increasing, and I know that it's something that I'm eventually going to want to add to my practice as well.
And I talked to
your
parents
question
because I found that, I found that a lot of kids who are tongue tied don't take pacifiers. Like my youngest, my older two lived on the passy and, we had to eventually take it. But my youngest could never keep one in from day one because he lacked the control of his tongue. Like he couldn't get it moving enough to even hold that thing in. So I sometimes if you're having trouble, not that you have to try a pacifier, but if they're really not able to soothe themselves, or like you said, with latching, a lot of times it is a tongue tie in there that nobody has necessarily noticed.
And parents after they have it done, parents are so happy.
Mm-hmm.
And so it's important to get the right resources. I don't think there's some offices that are maybe more aggressive and think everybody has a tongue tie. But there are also some pediatricians that are like, not everyone has it. And I'm definitely in the stance of go to the right people. If you're having issues, have someone look at it. And if it's using mom intuition as well.
Yeah.
Because if you feel something's not right, go and talk to a professional that will listen to you.
Yep.
And the other thing is that not every doctor is the right fit for you. Just because you start going to that pediatrician, you don't have to stay with them.
Mm-hmm.
It's just like the dentist. I'm super exuberant and that may not be the same. That may not be everybody's flavor. And I get that, but you want to find who's the best team member. That's the way that I think you need to look at your pediatrician, your pediatric dentist, and anything, honestly, is finding who's going to allow you to be the best advocate for your family.
Perfect. Thank you.
You're welcome. This is the maxillary frenum. Most kids who have a tongue tie, they also have an issue with their lip as well. This is one where they may clip it at the same time. There's the current guidelines on pediatric dentistry is you usually don't do anything with that. Most kids tear it themselves when they're falling. Blood mixed with spit looks like blood. It's a terrible accident. Everyone freaks out. Usually they just performed a surgery on themselves. The tongue, they can't do this, but this one they can do themselves. And then if it stays around and they have that space in between their teeth, even when those permanent canines come in around 12, that's when an orthodontist may get involved and say, yeah, we should probably cut this tie right here. Most kids fall. Most kids tear it. It's just the way life is. COVID and dentistry. Something to keep in mind. Is the dental office safe? we've been open. So most dentists were encouraged to close in March. And we did. We were shut down for 2 months. It was a recommendation in Missouri. It wasn't something that was mandated, but most of my colleagues listened to that and closed down for 2 months. And since that time, we've opened back up in May. There's been no sourcing of COVID being spread in dental offices, which is fantastic. A lot of that has to do with the fact we've always been around gross things like spit. Our offices are accustomed to having to clean everything up. Some things you may notice that are different than before. We're wearing N95 masks to protect ourselves. We also are wearing shields. So you'll notice this shield here. This was right when we opened up and I was covering my hair. I only really cover my hair during surgeries now. I don't do it all the time just because it gets really hot, and having that much stuff on my head was giving me a headache, I'll be honest. But we're open. It's important to talk with your dentist to see what things they are doing. I know my waiting room has nothing in it, and we try to keep 0 families in the waiting room whatsoever. Not all dental offices have that capability, but just ask. If you have concerns, ask. However, since COVID, everybody's been at home and everyone's been snacking. The amount of cavities I've seen has gone up like crazy because everyone's at home, everyone's stressed. Research came out that with adult dentistry, people are grinding more often, people are more stressed out. The dental offices are safe. I highly recommend going back. And people have more issues because of COVID. Not just because of the virus, it's because of the stress that COVID has caused. So you bumped a tooth. Let's go on and talk about that really quick. Dental trauma, first of all, it's super normal. My college roommate literally called me last night. Her 2-year-old smacked his face and had a bloody mouth, and it happens. The cool thing about kids is whenever they have baby teeth, especially during that toddler age, it's like they were created with bumpers because the body fixes itself generally. When they have a hard trauma, usually that tooth, if it bumps up, those teeth pop back in about 6 weeks, and the pressure from their tongue moves that tooth right back into the position pretty close to where it was. The face is the 4th most common, and so the head is the body part where most accidents occur. This is something that I like telling parents. It's a good thing that you take those pictures because if they ever do have trauma, you want to make sure that you get a picture taken or you want to show that picture to the dentist. Oh, we have a new participant. Okay. And then trauma to baby teeth. These are the potential outcomes. These are things that parents, I think, like to know. If your kid falls on their face, what should I be concerned with? The potential outcomes are 1, the baby tooth just heals on its own. The younger the damage, the more likelihood for this. The other thing is it turns a yellow color. It's more opaque. Basically, the nerve resorbs on its own and the body heals itself, but it doesn't match the coloring. Another thing would be it turns dark. It's basically like it has a perpetual bruise on it. Those are the teeth that are most likely to abscess, and it will look like a pimple, like we showed with the ones with cavities. There are unfortunately kids that have always had perfect teeth, great brushing, great diet. They fell at some point because they jumped off of something. They may have hurt that tooth. Bottom line, I strongly believe after your child has bumped or hurt their tooth, say pretty significantly, go to the dentist, get a baseline x-ray. There's not going to be any way to tell if there's been changes yet if you go right away. However, by getting that baseline x-ray, the next time you come, we can see what the body's reaction is to that damage. Here's that purplish tinge. Here's an abscess. And this is what happens about 30% of the time. It's like a scar. So after an abscess, if it sits too long, it can sometimes affect that developing permanent tooth. That's why we like catching these things early and getting those x-rays. Avulsion, the only true dental emergency, this is why people go into dentistry because they can go golfing all the time, is that the only real time that you really have to come into the emergency room is, or not the emergency room, a true dental emergency where the dentist needs to drop their golf club and go into the office, is if a tooth completely comes out of the mouth. If a tooth completely comes out of the mouth, I'm going to give you some tips. I'm going to leave pictures out because they usually gross people that aren't dentists out. So what I recommend doing, if the tooth comes completely out, what you want to do is put that tooth either back in if you're comfortable or put it in milk. call a dentist. What the dentist will do is they'll actually put that tooth right back in and put wires on it that kind of look like braces. So that is the true dental emergency. Definitely call your dentist. If your dentist doesn't answer, find a dentist, because the emergency room doesn't always know what to do. So takeaways of my talk, I actually timed this well, are first, establish the dental home by 1. If you haven't done it yet, it's okay. I just recommend doing that as soon as possible. The second thing is try to stay away from benzocaine or those teething necklaces. There are other things out there. This is one thing where I think asking your friends what they did, ibuprofen when nights are really bad is okay, as long as you have clearance from your pediatrician. This is my biggie. Cavities are contagious. The best thing you can do for your kid is have a healthy mouth yourself. And the last thing to touch your mouth at night should be a toothbrush. So the big thing is, if we can start out right with desensitization, hopefully they don't have that fear of the dentist that I apologized about earlier. And I have a survey from another lecture that I forgot to take down. But this is my name. If you ever have any questions, feel free to email me. And thank you.